How does Veterans Affairs healthcare compare to private healthcare? Have you ever wondered how Veterans Affairs healthcare stacks up against private healthcare? This comparison is essential for understanding how we serve our veterans. Veterans Affairs healthcare is a government-run system specifically designed for veterans. It provides specialized services for their unique needs, such as mental health and rehabilitation. This system is funded through federal budgets and operates its own hospitals and clinics. On the other hand, private health care is delivered by independent providers and hospitals. It is primarily funded through insurance, out-of-pocket payments, and government programs like Medicare and Medicaid. The differences between these two systems are significant and often debated. One major point of discussion is access and choice. Many argue that while Veterans Affairs healthcare is comprehensive, it suffers from bureaucratic inefficiencies. This can lead to long wait times and limited provider choices. Republicans advocate for expanding veterans' access to private healthcare providers. They believe that lowering barriers to community care will give veterans more freedom to choose their doctors and receive timely care outside the Veterans Affairs system. Cost and efficiency are also hot topics. The Veterans Affairs system is often seen as a bloated bureaucracy that struggles with cost control. Republicans argue that shifting toward privatization or expanded community care could reduce government overhead and improve cost-effectiveness. However, critics point out that spending on community care has increased significantly, raising concerns about sustainability. Quality and coordination present another layer of complexity. Private healthcare can offer faster access to specialized treatments and advanced technologies. Yet, Veterans Affairs healthcare provides integrated care tailored to veterans' specific needs, which can be hard to replicate in the private sector. The challenge lies in balancing expanded private care access without undermining the specialized services that Veterans Affairs offers. Staffing and capacity issues further complicate the picture. The Veterans Affairs system faces staffing shortages, especially in mental health services. Some argue that allowing more veterans to seek care in the private sector could alleviate these challenges. However, the private healthcare system is also strained, particularly in rural areas where providers are scarce. Legislative efforts like the Veterans Access Act and proposals under Project 2025 reflected Republican priorities to shift funding and care delivery toward private providers. The 2018 Mission Act expanded veterans' ability to access private sector care, but rising costs and implementation challenges have sparked ongoing debates. Republicans argue that reducing barriers to private care gives veterans more choices and can lead to better health outcomes. However, critics warn that an over-reliance on private care could weaken the Veterans Affairs system, leaving veterans dependent on a private sector facing its own challenges. In summary, Veterans Affairs healthcare offers specialized services tailored to veterans but is often criticized for delays and limited choices. Private healthcare provides broader options and potentially faster access but lacks the veteran-specific focus of the Veterans Affairs system. The ongoing debate centers on how best to balance these approaches to serve veterans effectively and sustainably.